Hi, everyone. Welcome. My name's Jennifer Rinks, and I'm with the Marin Healthcare District. I'm a board member, and I'd like to welcome you tonight to our climate change seminar, public health seminar. And we have two really great presenters tonight. We have Lisa Santora, who's an MD and a master's in public health, and she's our Deputy Public Health Officer for Marin County. In this position, she provides clinical oversight for public health emergency preparedness, communicable disease prevention and control, and detention health. Prior to this role, she was the Chief Medical Officer for the Beach Cities Healthcare District. She's worked in federally qualified health centers across the country. Dr. Santora is a graduate of Rutgers, New Jersey Medical School and completed residencies in preventative medicine and family medicine in Buffalo and Miami. Joining Lisa is Christian Tubbs, who's currently the fire chief of the Southern Marin Fire Protection District and president of the California Fire Chiefs Association. Chief Tubbs began his career journey in 1978, serving primarily with the Mercer Island, Washington Fire Department. Chief Tubbs also spent 19 years in the Washington Task Force 1, one of the 28 FEMA urban search and rescue teams, and deployed to the Oklahoma City bombing and to Hurricane Katrina. Chief Tubbs has a Master of Science degree from the Grand Canyon University and a Master's of Arts degrees from the Naval Postgraduate School. His Naval Postgraduate School thesis was titled, "Conditions of Democratic Erosion. Has U.S. Democracy Reached a Tipping Point?" Chief Tubbs is also a graduate of the Harvard Kennedy School Senior Executives in State and Local Government program and earned his certificates in public policy and public leadership. Chief Tubbs is also an accredited fire chief through CPSE and the state of California and a graduate of the National Fire Academy Executive Fire Officers Program. So I'd like to welcome both of our panelists. We'll see Chris shortly. We're going to start with Dr. Santora, and she's going to be talking about the climate change and public health. So take it away, Dr. Santora. And also, I just want to let folks know we will have time for questions at the end of the presentations. We'll save plenty of time for questions. You can go ahead and chat those questions in the chat or the Q&A panel, and we'll be monitoring those. And if we also might potentially be able to unmute people to allow them to ask questions live if you would prefer that option. So thanks so much. And Lisa, take it away.
Thank you so much. Thanks for having me here tonight. I am slightly relieved after this rainfall, but this rainfall also portends atmospheric rivers. So it's truly with mixed emotions that we live in this space, hopefully at nearing the end of wildfire season, but what is approaching to be a really challenging climate for us in Marin County, and a climate that many people who started their lives in Marin County, it's different than when it was 50 years ago. When I came in to Marin County, it was in 2015, and during my first week here, I was deployed to the Lake County fires. And so since 2015, during my tenure in Marin County, I've only experienced the effects of climate change in Marin County. So I've had to adapt to that and also learn all the dynamic forces afoot with climate change in our community. So it is real. I think we went through a long period of time where people were not accepting that climate change was a part of our reality. And we have sufficient data really to show that climate change is happening in our community. And sadly, our neighbors and residents have experienced firsthand the devastating effects of climate change in our community. We look at the vulnerability factors in our community, and really there is a difference across Marin County. There are those who have followed guidance from our fire officials and public health officials around increasing their individual and neighborhood preparedness. They also may have assets and resources if they do have to evacuate, and do not have access and functional needs, so are ready to receive alerts and follow those alerts because they have transportation. And then where the county really focuses on are the most vulnerable residents of our community, which are increasing in number as we age in our community. We know one of the goals of many people is to age in place in their home, and sometimes as you're aging, your ability to both harden your house and make it fire ready, as well as making other adaptations is not as feasible based potentially on ability or financial, both physical ability and financial ability and means. So that's an area that we really focus on. And I don't think we have to list all the exposure pathways. We really have experienced it firsthand. We've gone through heat events this summer. We've gone through air quality events. I think it was it last year in November when our skies turned orange. We also recognizing that change in air quality, but it affects our entire community. And what we've experienced, unfortunately, the silver lining of the pandemic, or fortunately, the silver lining of the pandemic is really, we are a more resilient community. Our emergency operations centers and our first responders have grown muscles in space of response, but we also still need to, that was towards a pandemic in response, and we really need to shift back focus towards an all hazards preparedness, where we are focusing on, again, all the different hazards that could impact our community. And just on that bottom slide, you'll just see all the different ways that climate change can affect our most vulnerable populations. And then from a public health perspective, one of our responsibilities is really protecting our healthcare systems. We have 3 hospitals in the county, and we already are seeing right now what it's like to be at capacity with just respiratory syncytial virus, or RSV, in our community. And so one of our goals is really mitigating that, so our hospitals can fully serve the community for the regular care that they provide that is not related to climate change. So this is what we look at. We're looking at the exposures in our community, the sensitivity that I described, and just our ability to adapt. I think that's one of the strengths that we saw, again, during our pandemic response, is our community's readiness and willingness and capabilities at adaptation. And that is something that we'll have to lean into again, even though many people are very fatigued. And again, always just looking at those acute effects. The news unfortunately shows all the sad stories that come out of climate change, where we saw stories from Hurricane Sandy, from the most recent hurricane in Florida. There's always stories to remind us that we all can be impacted. And I think the challenge as a community is not just to see that story, but to take action every time you hear a story about a vulnerable resident, just checking in on yourself and making sure you and your family is prepared, and then checking in on your neighbors and seeing who's in your community and how you can help others. We also look from a racial equity lens in our community. The first photo that I showed was from Marin City, and you may have seen in the news a significant increase in advocacy around preparing that community for the effects of climate change, and how there has been discrimination that has played a hand for decades in creating this racially inequitable climate change impact. And so we've seen across the United States, across our state, that our lowest income communities and communities of color were literally relegated to communities that were adjacent to industrial zones and have always had an impact, a higher degree of adversity related to exposure. And I think that's our challenge moving forward in this century, is how do we address racial equity when we look at climate change, and making sure we're making investments in communities that have been disproportionately affected and may not have the same resources to strengthen their infrastructure, literally. So from a public health perspective, the other thing we look at is age. We know pregnant women and children are at high risk, and then our school-age children and older adults. And so you'll see air quality guidance from us, heat risk guidance from us, and we really are targeting that towards, and our resources towards those most vulnerable populations. So this is all the tic-tac-toe board of all of the things that we look at in our planning efforts as we're preparing an all hazards risk. Again, we've seen that we've potentially have had to have sheltering for floods. We've had, we're looking at, again, air quality, where we open severe weather emergency shelters for poor air quality days. We also are looking at preparing right now for our severe weather emergency shelter during the winter season for persons experiencing homelessness. So we really are, again, this is your all hazards approach to climate change, and seeing that it's not just one outcome that we're looking at as we navigate in this new environment. So this is the orange day that I described. I was returning, I had the fortune to go to Hawaii, and this is what I returned to. And it was really just shocking, honestly, to see this dramatic impact on our community, even after going through multiple wildfire seasons. And what this also shows is, again, just the change in air quality and how our most vulnerable populations, people with asthma and cardiovascular disease, are going to be at increased risk for having an asthma exacerbation, potentially requiring hospitalization, or having a cardiovascular event requiring hospitalization. So again, how can we, doing everything we can to mitigate those effects. So I mentioned that. The other thing that comes up is school closures. And this is a really challenging issue from a public health perspective. We know at the end of a long week of poor air quality, our teachers and school staff are fatigued, and we're seeing increased absences. They also might be navigating, for example, wildfire evacuations themselves. Many of us live in Marin County, but a lot of our staff are coming from other counties that might have direct impact by wildfires. And there have been school closures, but the reality is, again, from a racial equity lens, the air quality in many of our schools actually may be better than some of the houses across the county. And when children are excluded from school, like we saw during the pandemic, it really can be detrimentally impact their social and emotional well-being. It also can impact their accessibility to food. A lot of our children in the county have access to free and reduced lunch, and going to school is where children receive their nutrition. So we take it really seriously around any recommendation we would have around a school closure. What stresses me out during the season is not only the severe, it's pretty stressful all year round when I think about it. We don't have a season. Maybe the shoulder seasons were slightly relaxed as we prepare for wildfire season. And this was feels like a really short shoulder to go from wildfire season into a colder weather season. And one of the things that's also stressful for our system is, as we've seen efforts from PG&E to mitigate the risk of wildfires, we have also seen extended power outages. And as we have seen our community age, a lot of our community ages and live safely in place because they have durable medical equipment that is electrically powered. But if they don't have electricity for an extended period of time, they may not have access to the medicine that they need. For example, insulin that needs to be refrigerated, access to a BiPAP machine that helps them sleep at night. And that's where we see increased calls to our 911 emergency system. And during those events, we've actually used our Marin Medical Reserve Corps to literally staff a room on the side of our communications center at the sheriff's building, so the 911 operators can transfer calls directly to nurses, again, trying to decrease the impact on those emergency systems. Again, one of our core responsibilities in public health is maintaining that emergency response system and then mitigating any impacts on our hospitals so they can continue to provide care in the community. So this is what we look at in our emergency planning. We just regrouped this week actually to engage key internal staff in what does Health and Human Services do during an extended power outage? What are our roles and responsibilities of some of our standing programs? And then where do we extend ourselves as disaster service workers? So where we have seen, and this is kind of goes up from the lowest risk to the highest risk, is during past power outages, we've seen falls in our senior apartments. Again, people have elevators. They may not be able to use elevators that they depended on previously. So there's a higher risk of falls. There might not be light in both their apartment itself and in the hallways, which increases the risk for falls. We see people often calling our 911 system because they're scared. They're just feeling very socially isolated and disconnected. And they're not calling because they're at risk of actually a poor health outcome. It's a fear-based response and wanting to connect when they just feel it's dark and they feel alone, especially if they have early or even severe neurocognitive decline. It's fear. Working again, those homebound residents. I already mentioned the electronic dependent medical devices. And then one of our challenges also has been maintaining our long-term care facilities residents. Again, imagine a facility losing power outages, losing power, and we have nursing homes that actually provide medical care and ventilators, that level of care again, providing care for people experiencing dementia. So that's one of our priorities, is again, maintaining power to those critical facilities. So again, if they had to evacuate, one of the evacuation plans is those residents who live in our nursing homes or skilled nursing facilities to go to the hospitals. And that is not an ideal situation when we're transferring residents from long-term care facilities into hospitals. So our goal is to prevent that from happening. On to heat. I think we've cleared our excessive heat events, but it was we had a really significant heat event. We're using a new heat risk prototype to inform our response activities. We see, and it's a new tool really based on providing more of a geographic response plan. We know there's different microclimates across Marin County. We know our coasts stay pretty cool, but that means we have a lot of traffic coming into the county that has to be considered. When we enter a day that's a really hot day, our EOC is awake, alert, oriented to self, and our teams are active because we know we need to prepare for any event, especially when there's large populations on the West Coast. But it's cooler, so it's realistic why the entire Bay Area is moving to the West Coast, which means a higher number of people in our county. This is actually data from the heat event from early September. We had 20, and we have a great system. We're really trying to have a data-driven response and data-driven planning. We were able to see that we had 22 emergency department visits and 3 hospitalizations related to that heat event. And then it's just you'll see a diverse array of reasons why people entered into our healthcare system during those heat events, and most of them were preventable, honestly. Some people, again, people not having a caregiver during the day, probably education around hydration when you're outside working, and making sure as employers that they are educating their employees around staying hydrated. And then we often see substance use related, both with heat events as well as cold events. And again, these are preventable. So this is a really busy picture. I'm not expecting everyone to absorb it all, but we'll share this slide deck, so you'll be able to click on and see kind of the global response as we really are thinking globally but acting locally. We are all interconnected across the world. As China industrializes, that will be a continuing impact on the West Coast of California, for example. So how do we think holistically and work in partnership across the globe in order to mitigate the impacts of climate change and really shift towards a more sustainable planet? And also, again, just with what we saw with COVID responses is just the challenge of managing misinformation. And that's part of the climate change. That was actually part of the climate change world before we ever had a COVID pandemic, is really managing information, managing sharing. And then again, what we saw during COVID response, and I do think it's a possibility, when you have an existential threat like a pandemic, you see communities come together and harness powers that they didn't think they had, and to affect change. And hopefully we don't go back into our silos, but we continue to work together collaboratively across different sectors to mitigate climate change. And again, recognizing that we can do our best in Marin County, but we are part of a region, we're part of a state, we're part of a nation, and it has to be at all levels if we're really gonna create a healthier generation for our kids. So a word that you'll often see is, I hear from us, is resilience. We need to be adaptable, we need to be resilient. We need to work across those sectors. It's not just county or government work to, again, have a strong emergency response. We really depend on neighbors helping neighbors, on working collaboratively across our industries, fire, working with public health. This is really key for us being successful as we move forward, and having the same message, having the same actions, so everyone is on the same page. That being said, I lived in Miami, so I follow hurricanes. It's one of the things I look at. And when I do follow them, I actually go to the county websites to see how the counties are responding and the supports that they're providing. And one of the success stories you may have heard is from Babcock Ranch, which was a community that was built to be a resilient community. So there really was a thoughtfulness in planning this community. And I think that's what I would expect to see from California as we move forward with new planned communities, that there should be resilience centers and resilient cities, and that there should be a solar on almost anything that doesn't have a redwood or trees over it. We really should have a significant solar infrastructure. But we're not there yet in our community right now. We still are more in response mode, where we're partnering with cities and towns on having cooling centers and the winter shelters that I described. That being said, after we released the Community Development Agency from their EOC duty, EOC is Emergency Operations Center, their duty in pandemic response, they got back to action and working on their climate action plan, looking at opportunities to electrify Marin and bringing more solar into Marin. So these are just links that you can look at to learn more about what the county's doing. The county is also engaged in significant work on sea level rise, that we are expecting to have a significant king tide again coming up in this December, I think. And that's going to impact that will cause the same roadway that you saw on that first slide will happen again. So we have a lot of known knowns in our community. And unfortunately, we are expecting sea level rise. So we expect even to have more flooding across the county as literally inches increase in our bays. Marin Can, again, is this is the drawdown Marin has become Marin Can. These are links that you can click on to learn, again, what resources that you may have, rebates and other things, and how you can engage in the community, work together. So we're all working together on the same goals to, again, create a more resilient community. And I'm sure this will be on the chief's presentation too. Our call to action is everyone should be registered for alerts. That is the most important thing. Everyone should be on Alert Marin. Everyone should be on Nixle for the community. They should be on their PG&E outage alert. Should have a weather radio. Planning, if you don't have access to internet, you don't have access to anything, having a weather radio in your home. We are directing everyone when something does happen. If the internet's up, we're centralizing all of our information at emergency.marincounty.org. That's where we gather information from all the different jurisdictions. If there's something, we're going to have a team that's updating. So you may be going to your local city or town, but also know that we'll be gathering what we call our operational area information. So it might be what gas stations are open, it might be where cooling centers are, but this is the central point of information. Prepare for, and I'm not going to spend too much time, prepare for extended power outages, really, especially if you know vulnerable patients or vulnerable residents that are in your neighborhood, making sure they have the resources so they're ready and prepared. We have to expect that we're going to have extended power outages. And it's a great time if you have the means to look at resources like solar. We did that after going through too many power outages and actually having to activate and deploy. We were able to get rebates for solar. So looking into those opportunities. And that's it for me. And I think we're going to hold questions till the end. So I'm going to stop sharing my slide.
Thank you, Lisa. That was terrific. And we are going to hold questions till the end. And next up, we have Chief Tubbs. So Lewis, if you want to go ahead and bring up Chief Tubbs spot, there we go. Okay. And then where did Chris go? We need to get Chris back. Okay, we're going to. All right.
All right, are you ready?
Yeah, we are ready, I think. Thank you.
Thanks again for the invitation and for being able to be here tonight and present. And Lewis is going to be clicking the slides along for me. Actually, if you go back one slide, Lewis, there's just a couple of points I wanted to touch on in the opening slide. Three important takeaways for tonight. The first is just the importance of becoming informed about preparedness, prevention, and mitigation. The second is to learn where to go for more information, and I'll touch on that a little bit at the end of the presentation. And then third, and maybe the most important one, is to not feel overwhelmed. The information certainly I'm presenting tonight, there's a lot, and it could be, I could go into greater detail, and that could cause some folks to feel a little bit overwhelmed. I know sometimes when I'm reading the latest research on some of these areas, I feel a little bit overwhelmed. So as I used to tell my kids growing up, how to eat an elephant one bite at a time. And that would be the takeaway I would have here tonight for the folks who are watching is, you may not be able to absorb sort of all of the things, but just start in one area. And that's a great place to start. And that makes a difference in and of itself. Next slide. So the agenda tonight, what I really want to call out on here is, while we're going to talk about some of what we would call kind of our standard bread and butter fire prevention information, we've also added a little discussion on home insurance and the local wildfire initiatives, and then some respirator information. And Dr. Santora can certainly chime in if I don't quite get this exactly right. She's the expert, but this is based on the information that we have. Next slide. So goals for a fire department. So the fundamental purpose of a fire department really is about managing community risk. And our primary objectives in sort of that goal is to protect the community. That means the individuals, protect the community's property, and of course, protect the environment. Next slide. And managing community risk requires a strong relationship between the community and the fire department. By strategically working together, we can manage and reduce community risk. Fire doesn't care about county lines or jurisdictional boundaries, but to undertake a safer, more resilient community, a partnership with the fire department and the community is really, really critical. Next. So though fire spreads through direct flame contact and radiant heat, upwards of 90% of the structures that are destroyed in a wildland fire happen as a result of ember travel. And I share this because it explains why we focus on creating defensible space and encourage home hardening. Next slide. And so, Lewis, I'll have you click the play button here. And this is a video that just shows embers. Hopefully you guys can see that pretty, whoops. Gotta go back there. You just click play and it'll run. Yeah. So off to the right, you see a crown, what we call a crown fire there. The fires at the top of the trees, and then you see all these embers falling down. Well, as the air movement pushes those two places away from the crown fire, they will look for sources of ignition. And as you can see off to the left there, most likely some of those fires off to the left have been as a result of ember travel. Go ahead, next slide. So as embers travel and fall to the ground, they look for sources of fuel. Reducing the likelihood of ignition requires kind of this house out approach. And that first zone, the 0 to 5 feet, is the most critical because of its proximity to the house. And so that's one of the areas that we really focus on when we're doing our defensible space inspections and working with homeowners, is trying to ensure that we minimize the amount of ignitable fuel next to the house so that we can help preserve that house and make it a survivable home. So what is the difference between being a survivable home and a defensible home? A defensible home is one in which it requires a fire department's presence to be there to either prevent or extinguish the fire. A survivable home is one where we have taken steps to create a resilient environment, meaning we're doing defensible space around the home, we're doing home hardening techniques and things such as that. And just as way sort of to, I guess, some numbers behind this. So in my district, we have 20 firefighters on duty 24 hours a day amongst our 5 stations, and we serve a population of about 40,000 people. So you can imagine we don't have enough firefighters to protect every single home. So this is why this community partnership is so critical. And if we can prevent sources of ignition near a home, then we won't have to be at that house defending it, because it will not most likely get ignited. So next slide. And these are just some observations from the Institute for Business and Home Safety. Oops. Next slide there, Lewis. There we go. And that is, again, talking about the importance of creating this defensible space in that 0 to 5 feet range. Next slide. Now, this video clip here is done by IBHS and our own Dr. Steve Quarles in Mill Valley, who has studied for years the effects of ember travel. And what we're showing here is a video, and go ahead and press play on that, Lewis, is that this structure shows... Excellent. So what this video is designed to show is a contrast of a home in which there has been home hardening and defensible space work done. That is on the right. And then on the left is a home that has not. And as the video plays, you can see embers down in the lower right-hand corner being forced out by a fan onto these structures. And this is to replicate the actual conditions in a wildland fire. And again, the purpose of this test and the video is to demonstrate visually the power of doing this kind of work around your home. Next slide. So as I mentioned, I want to talk a little bit about the insurance component to this. Certainly, I think, there are a number of Marin residents who sort of felt this pain. It's not uncommon for us to get phone calls from residents saying either their policy has been canceled or their insurance rates are increasing. This has been an increasing challenge for us in the state of California, and I would offer some encouragement. Next slide. There's been quite a bit of work going on in the background. So Cal Chiefs has been working with key stakeholders, including IBHS, the insurance companies, the State Insurance Commission. And we're working to identify mitigations that matter. These are mitigations that are demonstrably effective. And the objective is to link a defensible space inspection with actions taken by the homeowner that then link to accurate risk assessments and insurance policies and rates that credit the defensible space and home hardening work being done by the homeowner. There's some encouraging work going on there. We're optimistic that this will eventually lead to a reduction in cancellations and a reduction in policy increases that are at this point in time seem rather arbitrary. Next slide. So with regard to some of our local wildfire initiatives and investments in the district in 2018, our residents passed Measure U, which was a parcel tax that raises about $3 million a year. And of that $3 million, $1 million approximately is dedicated to our different prescriptions, programs, and services around wildfire risk reduction. In 2020, as many of you know, the residents of Marin County as a whole passed Measure C, which is a 10-year parcel tax that raises about $20 million a year, and again, used for fire protection and prevention services countywide with this focus on wildfire risk reduction. Next slide. So that parcel tax in 2020 created what's called the Marin Wildfire Prevention Authority, or the MWPA. Marin County is broken into 5 operational zones. You can see the colors there. My area is down there in the green, along with part of Marin County, specifically Marin City and some of the GGNRA area, as well as the city of Sausalito. And this is important because, go to the next slide, please. The funding is broken into 3 different buckets. The main bucket, which receives about 60% of that funding, is called the JPA Core. The funds that are dedicated to the JPA Core are to be used on a regional basis. And so what that means is that in the operational areas that I just showed you, we look to apply those monies for projects that go across jurisdictional boundaries and cover that region. The second bucket is what's called the Defensible Space Evaluation Home Hardening bucket, which is funds that are sent directly to the agency for defensible space inspection programs and services, home hardening grants, and things like that. The third is local mitigation, which is again a 20% component, and those funds are given to the agency for them to spend on projects that are unique or special to their area, their community. As an example, for Southern Marin, the last 2 years, we've dedicated most of our funding to the installation of LRAD, which is long-range acoustical devices. And I think I have a slide coming up about that, so I'll hold sort of describing on that. Next slide. Real quickly on evacuation, the goal is really simple, right? It's from moving from harm's way to non-harm's way. Now, there are 2 types of evacuation notifications you might get. One is a warning, and the other is an order. And it's important for me to describe the differences between those. A warning means that there's a potential threat to your life and or your property. So this is sort of an early warning. It gives you time to get your stuff together. And if you want to head out, we certainly encourage that when a warning comes out. An order is an immediate threat, and it's a lawful order to leave the area right away, and you won't be allowed back in until that order is lifted. So next slide. When planning for evacuations, we try to encourage people in their plan to identify 2 routes and 2 modes. We don't know, obviously, where the fire will be until the fire occurs. But as part of your pre-planning, if you can identify 2 ways out, much like you might do for your own home planning, if you had a fire inside your house, we always encourage people to have 2 ways out of the house. And in this case with evacuations, 2 modes. So if you have a vehicle and let's say the vehicle is unable to move, or would it be safe to use a bicycle, or can you walk down a path? Or a number of the areas in our communities have what are called steps, lanes, and paths, which are also part of the evacuation system. If you have a vehicle, one of the things we strongly encourage our residents is, if you can, only take 1 vehicle. The less vehicles we have on the road, the easier it is for us to evacuate, and certainly evacuate everyone as quickly as we can. Next slide. Each year, the district sends out a flyer to our community, and we have evacuation maps on our website as well. This is just one side of the flyer. I'll call your attention to the right side of the flyer, which is this is a particular part of the district that we serve, and it identifies a primary and a secondary route, which could again assist you in your planning when you're trying to identify 2 routes out of your neighborhood. Next slide. Dr. Santora really sort of began to touch on this. Again, I echo exactly what she said about if I can encourage any action tonight is to ensure that you're signed up for Alert Marin. If you have a home phone, you are automatically subscribed into that. If you have a mobile phone, you are not, and it requires a proactive act on your part. So we would encourage you to go to that site and sign up for that. Again, Nixle as well. The important thing to know about notifications is that no system is 100% workable all the time, right? It's not fail-safe. And so in our communications and our alert and notification systems, we work to build redundancy. And this is what this slide here is designed to show are the different types of communication systems that we have. And this is to ensure that we do everything we can to get the notifications out to the community well in advance. Next slide. So I mentioned earlier long-range acoustic devices. These are a technology that was actually originally developed by the military. It has a civilian application. These are similar to community sirens. Some communities have had those. That generally will send out an alert like for a tsunami or something like that, earthquake. But what these do is they actually have a verbal component. So we have pre-scripted messages that we have already recorded. We can also customize them on the fly. We can identify a zone or multiple zones that need to have a message, and we can send that message out so residents will actually hear a verbal command versus just a siren, which is really more of an alert. The map in the slide is designed to show where we currently have our LRAD sites. Those are the green ones. The yellow orangish ones are the planned ones for this next fiscal year. We have a campaign in Southern Marin called Did You Hear It? And what we're doing is we are testing these sirens on a regular basis, and we invite the community to respond to our surveys. And this way it actually helps us create data points around where we have good coverage or where we may need to add coverage or do what is called sound sculpting. Next slide. So actually, let's go to the very next slide. I want to touch really briefly on respirators, and Dr. Santora mentioned this earlier. Obviously, during the fire season, especially when this area gets inundated with wildland smoke, that's a concern for folks, especially those who have respiratory issues such as asthma or other cardiac events or cardiac issues, as Dr. Santora mentioned. So the one type of mask that we certainly encourage people to purchase and have on hand handy is the N95. So the N95 mask filters out 95% of particles that are larger than 0.3 microns. And they're very efficient at keeping out the 2.5 micron particles, which are typically found in wildfire smoke. Next slide. Again, Dr. Santora was touching on this a little bit earlier. In Marin County, we have this portal called the Marin Public Emergency Portal. It's designed to put information up there for residents, for them to know about ongoing emergencies or disasters, evacuation information, flood information, and so on. And I certainly encourage people to put that in their browser history or keep that as a bookmark. Next slide. Another website here in Marin County that we direct our residents to is for personal preparedness. It's called Ready Marin. We have a great group of folks who have been working on this site for quite some time. It is full of information about the things that you can do to prepare for any sort of disaster or emergency, such as creating go kits, NRGs, those kinds of things. Next slide. And then finally, I would call your attention to our Fire Safe Marin organization here in Marin County, where you can find, again, a tremendous amount of information around defensible space and home hardening, including there are some excellent lists about the types of plants that we encourage to have on your landscape and those that we discourage you to have on your landscape. And so with that, next slide. I'm certainly ready for Q&A, but I'll add one final point is I've shared a list of links with Lewis, and I understand that this webinar tonight will be posted. And so that information, those links will be posted as well, and you can go to those websites and find that information. Thank you.
Thank you so much, Chris. I've actually been dropping links in the chat for a lot of those, but we will share the whole list and post those. So thank you both amazing presentations. And Chris, I'm amazed that you got, Chief Tubbs, that you got through all of those slides as quickly as you did. There was so much information. So I really encourage folks to spend some time with the slide deck. We will have both of their slide decks posted. There was a lot of stuff in there that didn't get necessarily talked about, but great resources for people. So one of the things, there's a couple of questions that have come in. One of the things I was wondering about, Chris Tubbs, you talked about having 2 modes out, like being able to go on foot and being able to go on a car and all the little paths and things. And I certainly know near where I live on a hill, and there are now paths that go downtown, which are just great. But I also know that there's a number of people that live downtown, but they don't have cars, because there's been a big push to get people to rely on public transportation and to, be car free. How do those people evacuate? So like, just say you're in downtown Mill Valley, downtown Fairfax, and it's an evacuation order and you've got to get out. Normally you'd go to the bus stop and you'd catch a bus to get to where you were going. What do you do now?
Well, one of the things that we've been working on, certainly in the Southern Marin area, is creating what are called community refuge areas, CRAs. And the CRAs are designed to be sort of that holding spot, if you will. If folks need a place to gather, it's sort of a, let's get you out temporarily out of harm's way, let's stage you, and then we can bring in those resources, whether that is to bring in some buses or other forms of transportation that we can then shuttle people to a new location. But it's also designed to actually stage the folks as they leave, so that we have a little bit more of a controlled and organized evacuation, so we don't clog the roadways and then get to the point where no one can get out. And as I think folks know, this became a really huge problem at the Paradise Fire.
Yeah. So is that something that you work on with Dr. Santora? Is that something that the county's participating in, those staging areas? And how do we find out more about where they are? Like, where are they in different communities in Marin?
Yeah, so I know for the Southern Marin Fire District and the Mill Valley Fire Department, we have been posting that information on our website. It's still a little bit in its infancy. We plan on doing signage in these areas where there'll be a sign that identifies it as a community refuge area. There'll be a barcode on it that when you link it to your phone, you'll get a whole bunch of information about things that you can do, steps that you can take. So it's still in its infancy. I don't know that the CRAs are fully populated across the county. To your question about working with Dr. Santora and our public health team, yes, we work with our public health team very, very closely. They're an amazing group of people. I can't say enough about Dr. Santora during the COVID, the pandemic. She worked tirelessly. I don't think she slept for 2 years.
I started sleeping, but there is coordination. And again, some of it's still developing, because one of our responsibilities, public health has taken on the mass care supports. That's an emergency service function. We love acronyms in emergency preparedness and response. And typically it lives in social services. But what we've learned is that in a medium-sized county, it really is public health emergency preparedness that has the muscles around planning. So we've moved that in that mass care responsibility into public health. And so just as there might be CRAs, then that might lead to a temporary evacuation point. And so as you can imagine, and hopefully this does not happen, and we're doing all the hardening. That video is so compelling, all the hardening that we can to really mitigate this. But as our local jurisdictions and fire departments would be responding and setting up CRAs, potentially our EOC and Health and Human Services would be working at the same time to set up temporary evacuation points, really where and then potentially, again, back at the Marin Center, an evacuation center. We have had the fortune, again, in many ways, that we have been the helpers, where we have received residents from Sonoma County. We're keenly aware that Marin Center is a great resource for that type of phenomenon, but we needed to expand our sheltering capacity. So we have been working to identify 5 sites across the county so we can really increase our capacity if there was a Marin County-based event. And lastly, before I shut up for a little bit, it's just recognizing that really encouraging people to heed the evacuation warnings. I know I do not practice what I am about to preach. I think we all want to stay at home. We feel safe at home, but for many people, it's better to leave early. Again, staying connected with neighbors and families, asking for help. Again, I'm not practicing what I'm preaching. We're horrible at asking for help. But as we are an aging community, asking for help and asking for help in your planning and your evacuation planning, asking for help early if you need a place to stay because you'll feel safer during an extended power outage, or even if you're only have received an alert and not the evacuation order, but you're in the warning. Leaving early is what's going to help us all as a community and be able to serve, identify those most vulnerable people that physically cannot come down that hill. Those are individuals we really want to encourage to have those advanced plans set in motion now, not next summer.
So 2 follow-up questions. For people that are unhoused, I mean, how do we get the word out to them? Do they know where to go? I go back to, you were talking about the most vulnerable people in our community, and I think about those. It's like, how, what efforts are being made to educate them about what they can do and what resources, where they should go?
Yes, we have partnerships. We have been strengthening our work on addressing homelessness in our community. I've been doing that in partnership with our local jurisdictions, as well as with Fire, Parks and Rec. I think when I say it's been an all hands on deck approach for the past few years, it really has been. It's strengthened our relationships. And again, homelessness, just like climate change, homelessness is something that touches us all. So we have community outreach teams. I know some of our local jurisdictions that have encampments have had plans if there had to be a relocation. For example, San Rafael, when there was an encampment under the 101, if there was an event, a fire, that would have to be evacuated immediately. So there were plans in place to relocate some of those encampments. And honestly, and Chief can speak to this better than me, some of those encampments actually would be your CRAs. If they're wide open spaces, that might be a preferred space for people to be. Sometimes that shelter in place for many might be the option based on the dynamics that fire is seeing at hand. And that's another uncomfortable feeling too, when you're advised to shelter in place, but you want to leave. And I think that's where we have to trust our first responders and our chiefs across the county, that they are seeing the larger picture of our operational area. And as much as you do not like the idea of shelter in place, it has you have been advised to do so because that is what's safest for yourself, what's for you and your property, and also for the community at large as they might be navigating and assessing a larger situation.
So in follow-up to that, our most vulnerable residents, the other thing that comes to mind is the 4-legged residents that many of us reside with and rely on. So in the CRA shelters and all of that, a lot of Marin people are really attached to their pets. Can they bring their pets? How does that all work?
I'm going to speak only shortly about the shelters, but I think the chief really should talk about pets, because I think that's a dynamic in play significantly that he's
people
seen
stay home
during
because
evacuations.
Yeah.
But Marin County loves its pets. And so we have pet-friendly shelters where people can both cohabitate with pets. We also have some pet-free zones because some people can't be around pets.
Mm-hmm.
And we have tremendous partnership in the Marin Humane Society, who with every activation at Marin Center, and we have all types of pets, including large animals. And again, have been heartened by that approach. But I think Chief really should speak about people's connectedness to their pets in their planning.
Yeah, you're exactly right, Dr. Santora. And we get a lot of requests from the community, either through individual contact or when we do community outreach with regards to those questions, right? If we're evacuating or any type of emergency or disaster, where does my pet or my pets fit into that? And so we have developed a number of resources. I wouldn't say that is a process that is sort of without ongoing evolution. We're always learning more. The community provides us additional information, but we connect up with key stakeholders, right? There's a number of organizations that we develop partnerships with, and I would direct folks to, again, our Ready Marin website, where I think you'll find much more of that specific kind of information. But in Marin County, Lisa is right. Pets are very much a part of the family, and so we have to build those into all of our planning processes.
And I'm a new pet owner. My daughter finally convinced me in year 3 of the pandemic to get a pet. But having that go kit, if you're having a go kit for yourself, having that go kit for your pet, I think again, that's this is a perfect time of year when we fall back and spring forward. Get your go kits checked out, check those batteries and all those other things, but don't forget about your pet in your planning.
Mhm.
Yeah. I would add one piece to that is, especially with the packs, if you have children or even if you have animals and their health conditions change, make sure you keep your packs up to date, whether that's with prescription or clothing. There's nothing worse than going, being forced to go somewhere and you open up your pack and your clothes don't fit, or you forgot your prescriptions, or you don't have an extra set of glasses. So that's not something that's like a one and done. That's something, as Lisa said, you need to revisit on a recurring basis.
Yeah, like your snacks and things, you need to like refresh those.
And if your family, one of the challenges we saw during when we were receiving shelter residents from Sonoma from long-term care facilities, because many people who are listening might have family members in long-term care facilities, is having a small go kit for their family members as well. That's something we are training our long-term care facilities so their staff are ready to go. We literally received residents who didn't know their names, didn't have any ID, didn't have reading glasses to see. And again, that's something that we're working with the facilities to make sure that they're ready if once they're given notice that each resident has a bag, literally like a small bag with their key personal items and identification. And if you're not if you have family members that aren't in Marin County, making sure that your loved ones have that same type of little go bag so they're ready to go if they had to evacuate a facility, which is a very frightening experience.
Yeah, and what about their like medical information if they're on specific medications or things like that?
That was one of our big learning lessons. We learned that the Marin Fairgrounds is can be confused with the Marin Petaluma Fairgrounds. And so one of our evacuations, we actually received people with significant medical illnesses because it was like a multiple evacuation, people that people with no medical conditions that were evacuated. I think it was Healdsburg. They were then evacuated from their shelter, had to be evacuated. They were supposed to be evacuated to a DMAT, which is a disaster medical team that had staged at the Marin Petaluma Fairgrounds, but the bus came all the way down to Marin. And so what reassures me every single time, we weren't ready to receive, but we always have that adaptability to be able to pull down resources as quick as possible in partnership with MarinHealth, the other clinics and hospitals. We are able to provide the supports of people with medical conditions and get the medicines that they have. But that's where, again, being prepared, talking to your doctor, getting that kind of that 30-day, that month extra supply that you can get so you can have that in your go bag, and making sure it's up to date will help us provide the care if you do have to stay at a shelter for 3 to 5 days. The reality in Marin is that many people will be able to relocate to a friend's or be able to afford a hotel, but there's also probably around 20 to 30% of our population that cannot. And we know that we need to be prepared to provide supports in a shelter, which includes pharmacy and finding out their medical conditions. But the more we know in advance and the more information they have in advance, it allows us to be more expeditious in providing the care they need.
Now, both of you have mentioned like Nexel and Alert Marin and signing up for all of those things, but I know in the Paradise Fire, a lot of cell phones failed and a lot of towers went down. And even when we have prolonged power outages, people's cell phones go down. What have we learned about that, and what steps have been taken in Marin to ensure that we do have that ability to communicate, especially as so many people have given up their landlines, which historically have been more robust?
Yeah, I think Dr. Santora referred to it early on in her presentation. One of those tools that we can add into this redundancy are the NOAA weather radios, which can be both battery operated and you can have a little self-wind power generator on the side. as well. So that's certainly one of those. But we do know that cell systems fail. To your question, in Paradise, that's exactly what happens. The infrastructure failed. And some of the other systems that we might normally use, like the WIA or the EAS, obviously weren't functioning because homes were on fire. Ultimately, our last line of defense is that we actually send out our police officers. In some cases, we may even send out other personnel from fire and law who maybe not be, on the field out in the operational area. But law enforcement primarily will go neighborhood by neighborhood, and they will issue a high-low siren on their cars and then deliver a verbal message. And again, you can find out more information on our websites as well.
And maybe, Chief, you can speak to this. You probably know a little bit more than I do, but even the landlines die during power outages because the way that they're structured, it's not the old school landline that it was like cord to cord. There's a base that might be at the end of your road and your neighborhood. And so it's not as reliable as you may assume it to be. So having those redundancies are key.
Yeah, Lisa's exactly right. The old technology sort of the wire, you pull it out of one plug and put another long gone. They're all computer-based systems, and so they're subject to any power outage. And certainly we've been trying to work for legislation that provides backup power on cell towers, but that's only one of the threats, right? If the tower itself is destroyed either by fire or damaged by fire, then it wouldn't matter whether you had a redundant power source or not. Again, there's no perfect system, and that's why this redundancy is so important. And that's why it's really important for our residents to not only sign up for these different systems like Alert, Marin, and Nexel, but to build additional redundancy and to know the different types of systems that are at their disposal, and then to be aware of them, right? The situational awareness is really, really critical.
And the other thing I learned that I hadn't known until I think it was probably the 2019 fires is a tower may go out north of us that is supplying us. So we might not be experiencing the wildfire conditions, but we potentially could lose power because one of the main towers, I believe it's in Sonoma, if that goes down, then Marin goes dark.
So sort of shifting gears, a different kind of question, and this one has to do with getting people's attention and paying attention to this. I mean, these are scary things you're talking about, right? And most of us don't like to go there. If we go there, we only go there for like a short period of time because there's been some emergency. And then pretty much we like to put our heads back in the sand because it's a lot more comfortable down there, not thinking about scary things like climate change and the wildfires that come with that. How do we get people to sort of stay present and to deal with this, this not wanting to deal with it, but needing to deal with it?
That's a really great question, and it's one that we've been challenged with. So I've been in the fire service over 40 years, and I'll tell you, it has been kind of the holy grail for us because prevention and education really are the key. And sadly, the North Bay fires in 2017, I really think sort of changed that dynamic for us very visibly. We have seen a shift in attitude. However, we recognize that will not last forever. With the sea of information coming at all of us every day, we're all challenged, right? And our greatest quest is how do we penetrate through that sea of information to get to people, and not only with the information, but more importantly, that results in them taking some form of action. And so that is an ongoing challenge. I would say that, one of our experiences since the North Bay fires is that while we've had great community interest, we've gotten to the point where we feel a little bit like we're preaching to the converted, meaning that many of our meetings, we see the same folks. And we are thankful for that they're there because every time you learn something new. But what about the folks who are not able to come? And so this is part of the challenge. And I don't know if Lisa and her team have found strategies that work. Ours is just really more the saturation and trying all sorts of different ways in which we connect with the individual or connect with neighborhoods and communities, and just being redundant and unceasing.
There's two things. I think one is working with our schools. So in 5th grade, there's ready training. And I think sometimes it's our kids that remind us what we should do. I had experience where the alarm I've trained my kids because I'm a responder in many ways, and the fire alarm went off in the house and my kids left and I stayed. And again, so it was like reminded me, you know, I have to continue to keep practicing with the kids, but at least they did what they were supposed to do. And then we, what we developed during our pandemic response is something called community response teams, where it was neighborhood based, Novato, Southern Marin, San Rafael, and West Marin. There's teams that are being funded that were primarily focused on COVID response, vaccination, testing. Now we see them shifting towards disaster planning, having bilingual materials, Spanish language training, really diversifying our connections to more grassroots space in our community is our next frontier. And again, many of our immigrant populations are very resilient. They come with skills and abilities that are probably in some ways more prepared than we are. So really having a strength-based approach where some of our immigrants have survived earthquakes in other countries as they come here. And again, they come with the know-how and skills in different spaces like construction, and really leaning into a strengths-based approach and seeing our community for all of its strengths together, so we can, because in a response, we're all going to be working together.
Well, that's yeah, I totally agree. And that's a great place to leave it. Do you each have one quick closing thought for us? I'll be respectful of everybody's time. We have reached our time. So one last closing thought that you'd like people to take away from this.
I'll go first, as I want the chief to end, because he has, I just so value his experience and how he's leading our community. But just to take one action and check on a family member or a friend, because you'll take care of yourself, but tomorrow, if you can check on a family member or a friend about what their plan is for extended power outage, that would be my ask, is extending beyond the choir.
Thank you.
Well, I would certainly echo and support Dr. Santora's recommendation, but I would also say, just as we said, as sort of at the beginning of the presentation, taking one step. If you can take one step, if that is preparing your go bag, if it is identifying evacuations, take one step today and then take another the next day.
All right. Well, thank you both so much. And thanks everybody for tuning in to this Marin Healthcare District seminar. Have a great night, everybody. And please, there's a lot here we learned. This material will be available on our website, so please share it with others and take steps to make yourself safe so that we all make it through the next emergency just fine. So thanks so much, everybody. Have a great night.
Thank you.